Hello there, and welcome to Together for Seniors, Meals on Wheels of Rhode Island's social media video series that helps older adults stay connected, healthy, and independent. We're so glad you joined us. I'm Meghan Grady, Executive Director at Meals on Wheels of Rhode Island, and we have a very special guest for you today. Dr. Nadia Mujahid. She's a physician at Brown Medicine's Division of Geriatrics and Palliative Medicine. Brown Medicine is a supporter of our 2021 Festival of Meals campaign. Doctor, welcome, and thank you for joining our program today.
Thank you so much, Meghan, for having me. I feel honored to be part of this campaign. Especially because Meals on Wheels does an extremely great job delivering meals to our seniors in Rhode Island, especially so important during this pandemic that we have been dealing with the last almost 2 years, I would say. So thank you.
Thank you. And we are proud to, remind everyone, because we talk about it all the time, we've operated without disruption during the COVID-19 pandemic. And that's something that we're incredibly proud of. But let's chat about that. The pandemic environment has caused us all to live differently, to work differently, and to consume our healthcare differently. Can you tell us how the pandemic has changed the landscape for geriatric healthcare?
Absolutely. I'll be honest with you, Meghan, we have come far along from the beginning of the pandemic. Early on in March and April of 2020, I remember patients calling us and canceling all their office visits. They were afraid to come into the office. We were afraid to see patients because generally a lot of times we have 10, 12 patients in a day, in half a day in geriatric medicine. And we didn't want patients to be waiting in the waiting room, in case they are somebody sick and they don't know and exposing. And we saw a huge cancellation. We came around it by calling them back and saying, hey, we are able to do televisits, telephone audio visitations, either by using the computer or the smartphones. The great thing is that even though seniors may not have smartphones themselves, their children or grandchildren or a caregiver may have smartphones, and that has really helped. Before 2020, I would say I would have never thought that I would feel comfortable taking care of a patient over the phone, like over the phone for a routine visit, not for an urgent kind of thing. And that has really changed and impacted. If anything, a lot more patients are easily coming in to be seen in person. But if something goes wrong and their ride doesn't come, they call our office and we just switch their office visit to a tele audio visit. And it's easy enough for us to get on the phone and take a look at that rash that bothers them and they cannot get a ride to come into the office. And I think that has really helped patients to be at home, because then I can see that rash, or I can take a look at the patient, or my colleagues can do it and assess and say, well, this can wait and this is what we are going to do in the meantime, or you really need to be seen in the urgent care or in the office today, or have to go to the emergency room. And that has really kind of changed how we do geriatric medicine now versus before the pandemic.
Well, we so appreciate you sharing your experience and your insight. What would you say are the main topics of concern to senior patients right now?
We are in the holiday month, and I get a ton of questions. I'll share two concerns. Number one, from what I hear from seniors, is how to safely spend time with family and friends during this holiday season. Over the course of the last almost 2 years, last year, the Christmas, the Hanukkah, the holiday season was very different. They were not vaccinated, or the vaccines had just been approved for emergency authorization. Most of the folks who got the vaccines were healthcare providers like myself. That was my Christmas present for me, last year. But most of the seniors had still not been vaccinated. They were basically spending their holidays in place, not really meeting family. The concern I see this time is how do I safely spend time with family? Mainly because although most of my patients are vaccinated, their great grandchild who is college bound or a grandchild who lives out of state and is not vaccinated is coming over. And their concern is how do I keep myself safe while meeting my loved one that I've not met over a year, sometimes more. And generally speaking, Meghan, I really focus on safety first. I think family is extremely important. But for my age group patient, as a geriatrician, I only see patients who are 65 and older. A good majority of my patient population are in their late 70s, 80s, and 90s. Even if they are vaccinated, they still can get a breakthrough infection, which mainly means that they are fully vaccinated against the coronavirus infection, but they can still get another, despite being vaccinated, they can actually get an infection or test positive. And I generally tell them that if there is an unvaccinated grandchild or someone visiting, meet them, but please wear a mask. If you are going to share a meal, you need to be not sitting next to them. These are just important basic safety measures. I still want them to have a, great Christmas and holiday season, whatever they celebrate, but safety first.
Wonderful. Well, I think when we think about all the struggles we've been through in this COVID-19 pandemic, anxiety and depression come to mind. It's been a challenging time for everyone, but especially older adults. What should caregivers, loved ones be looking for, that might help them identify an older adult that is struggling with anxiety or depression?
I think I've actually seen quite a bit of anxiety or depression in my patients. And in general, all of us may have felt that, a day is not great because we hear so many bad things sometimes, right? That's part of being human. And I just feel that it affects the seniors much more, especially the seniors that you guys serve because they are homebound. So they are not the ones who are able to get in the car and go and visit someone or go even for groceries or something like that. They hardly leave their homes. So some of the things that come to my mind is, are the patients or the residents at their baseline? If they were cheery and happy-go-lucky, always tidy and neat, and now they are unkept. They are slowly moving to the door to open the door, versus before it was not the case. If there's a change in anything, whether it's a physical change or a change in their behavior or how they are, I think that's a red flag to say, hey, what's up? Is something bothering you? How can I help you today? Something which can be very easy can make a huge difference in that person's life. It may be the holidays are coming up and they may have lost a family member or a loved one, and they're depressed because of that. And I think isolation sucks. And we all know that depression kills. So any signs of that is more towards depression. If somebody notices people to be irritable or repeating questions or being like really anxious to get things out, again, that's a sign that they may be suffering from anxiety for whatever reason. And checking on them, like I know that your drivers do a great job of at least like a quick check, like how they're doing, and have even found, people sometimes after they have fallen at home, because the delivery person is the first one to reach out, and they are alarmed when they don't come to the floor, to the door or something, is a huge thing that you guys do.
Well, thank you so much for joining us today on Together for Seniors. And thank you for all the important work that you do as a geriatrician to help keep our older adults using the Brown Medicine physician group safe.
Absolutely. Thank you so much, Meghan, for having me.
Well, we encourage you all to stay in touch via our Facebook page, our Twitter page, and we have Instagram too. For more information on how to make a donation to Meals on Wheels of Rhode Island, if you have time to volunteer with our home delivered meal program, or most importantly, to refer an older adult or maybe refer yourself to our home delivered meal program, visit our website at rimeals.org. Thank you so much and stay in touch.